Okay, welcome to kinesiology. Going to hope that this recording works. This has been quite an interesting learning curve this term. We're going to learn about kinesiology this term. Lots of new information, lots of information you already have. One of the things that is important is that you understand that the definition of kinesiology is the study of movement. Also, by the way, it is important that you be able to say the word kinesiology. If you have difficulty with that, practice it because it's pretty important. Kinesiology is going to refresh your memory on some things that you learned in anatomy, physiology. For those of you who may have had some exposure to physics, you're going to see and hear a few things that are going to relate to some of the terminology and ideas that you may have learned in the past. And geometry, which is going to directly relate to the use of the goniometer and the measurement of angles. When we think about kinesiology, there are some components that are static and some principles that are dynamic. Static are those non-moving types of principles that relate to the study of movement, and dynamic would be the principles of moving information. Kinetics are forces that cause movement. Now, in the human body, the force that causes movement is a muscle. Kinematics are elements of time, space, and or mass, types of aspects that affect a moving system. And when we discuss kinematics, we're going to focus very much on things like the joints. Now, there are osteokinematics, which relate to the movement of bones, and arthrokinematics that relate specifically to the movement that occurs at joints. And we'll get into that a little bit more in the next week or so. It is important you understand some very basic descriptive terminology in order to be able to read your textbook. Medial refers to something that's toward the middle, okay? And whereas lateral, a lateral surface would be further away from the middle or more around the exterior surface if we think about a body in anatomical position, and we're looking at the forearm. There is a medial surface and a lateral surface, which is the medial is closer towards the trunk and lateral is the outside edge of the forearm. Anterior refers to closer towards the front, and posterior refers to closer to the back. Front of the body, obviously your chest. Posterior surface is your back, where your spine is. Now there are other terms that we use that are synonymous with each of these. Anterior also may be called ventral. Ventral is the same as the anterior. And then specifically when we address the hand, we're going to talk about the anterior or ventral surface being the palmar surface. Dorsal is synonymous with posterior, and we remember that because of the dorsal fin on a shark. Distal is further away from the trunk, and proximal is closer towards the trunk. If we think about the arm, the hand is distal to the elbow. If we think about the arm again, the elbow is more proximal than the hand. Superior means it's on top of, more towards the ceiling. Inferior is lower towards the floor. Superficial is closer to the surface of your skin, and deep would refer to something that's further away from the surface, specifically referencing the skin. Bilateral is an important term to understand. When we hear the word bilateral, it refers to both sides of the body. Okay, we have our hands are we have bilateral hands, right? We have one on each side, two of them. Contralateral refers to the opposite side of the body. So my left hand is contralateral to my right hand, and ipsilateral refers to the same side of the body. So my right hand is ipsilateral to my right leg. When we think about different types of motion, your book goes through some examples. There are different types of ways that things move in a straight line. That's called linear, from one location to another, or what I like to refer to as from point A to point B. There is also angular movement, which is movement around a fixed point, and we're going to learn a bit more about that because that is one of the most common types of motion or movement in the human body. Angular is also referred to as rotation. Looking at linear movement, it's straight line movement, as I mentioned, from point A to point B. There are two different ways that can occur. Rectilinear is described in your book as maybe a child on a sled moving in a straight line from the top of a hill to the bottom of the hill, point A to point B. Curvilinear would be somebody who would be, say, for instance, diving on a diving board. They are going from point A to point B in the water, but they take more of a curved or arced pathway. Angular, as I mentioned, is movement around a fixed point. It's rotary movement, and it's the movement that occurs in most of our joints. If we think about the flexion of the elbow is a good example of angular, and your book does also show a nice picture of flexion and extension of the knee. What we do know about angular movement is this. As the motion occurs, we move through the same angle. Let's think about the elbow. As we were moving the hand into and the arm, forearm into a flexed position, flexing the elbow, bringing our hand toward our shoulder. The hand, and also a surface that's more proximal to the elbow, let's say somewhere in the middle of your forearm, is actually moving in the exact angle as each other. While the hand is at a 45-degree angle, that midpoint in the forearm is also at a 45-degree angle. They are the same. They are both moving in the same direction. They are both moving towards the humerus. They're both moving towards the humerus and the shoulder. And they also are taking the exact same amount of time to move through that angle. So as the hand is moving and the middle of the forearm is moving towards the humerus or towards the shoulder, it takes the exact same amount of time. What is different, however, is the distance. As my hand is moving towards my shoulder, the middle of my forearm is moving through less distance to get to the humerus or towards the shoulder than the hand is. All right, these are all reviews from pediatrics. Flexion, we know flexion to be the bending motion. Typically, we are going to see a decrease in the joint angle. I want to reference this picture here on the bottom of the page. This is anatomical position. As we think about motions and movements, and quite a bit of what we're going to do in this course, we're going to need to visualize that anatomical position. Extension is moving out of flexion back to a neutral position. If we think about the shoulder and flexing the arm, the shoulder, we move our hand out in front of us in a straight line directly in front of the body. As we are producing extension, we come straight back to a position where our arm is straight up and down and the joint angle is increasing. Except with the wrist and ankle, which we're going to talk about some different motions that are going to be referenced there. Hyperextension is moving beyond neutral. So after we've come down to a fully extended position and then we continue to move our arm towards the back surface of our body, that would be hyperextension. Abduction is moving away from midline. Adduction is moving toward midline. You're familiar with these terms. Keep in mind that as we reference these in class, we're going to try to use the words abduction and adduction to be sure that people are hearing the right thing. Circumduction is not a true movement. It is a combination of movements. It's the use of flexion, extension, AB, and adduction all at various different times to create sort of a turning or rotary type of look. That motion. If we take our arm and make a very large arm circle, that would be an example of circumduction. We are not going to use that. We're not going to measure that, although you might read about it in your book and reference it that way. Internal rotation is a motion of the shoulder where I'll go over this in class, but it is synonymous with medial rotation, and your book uses the term medial rotation. External rotation is synonymous with lateral rotation, and your book also references lateral rotation when we refer to the shoulder. Both of these motions only occur in the hip and shoulder. Protraction is a motion that occurs at the shoulder girdle. When we talk about the shoulder girdle, we talk about movement of the scapula. So when we protract the scapula, we're pulling them away from midline or away from the spine. I'll demonstrate in class. Retraction would be going back towards the midline or pulling your scapula, your shoulder blades back together tightly towards your spine. Inversion is an ankle motion that I will describe in class. Specific to the ankle is moving the ankle inward, and eversion is moving the ankle outward. Plantar flexion is pointing your toes downward, again, a term that is only used in the ankle. And dorsiflexion is the opposite of that, pulling your toes up towards the ceiling. Supination is a term that only references the forearm, and you're familiar with that. Your elbow is at 90 degrees and your hand is turned up, palm up, like you're holding a cup of soup. Pronation then is turning your palm down towards the floor. Horizontal adduction, if we begin with our shoulder at a 90-degree flexed position straight out in front of us, and we move our entire arm towards the midline, keeping your elbow straight, that's horizontal adduction. Also moving from that 90-degree flex position away from midline is horizontal abduction. Ulnar deviation is only in reference to the wrist. That is moving the hand towards the ulnar side. It is synonymous with adduction of the wrist, and we don't hear the words adduction of the wrist. It is ulnar deviation. Radial deviation is moving the wrist towards the radial side or the thumb side. And again, it's similar to abduction, but there is no abduction in the wrist. Lateral bending is a term that we use when we talk about the trunk. We say lateral bending right and lateral bending left. We will go over all of these in class.